In Asia and the Pacific, among the 3.2 billion women and men that make up the working age population, 2.1 billion constitute the workforce. Their work generates tax revenues to pay for essential goods and services. They ensure the well-being of dependent family members and power the economic growth needed for sustainable development. But our region's workforce is under pressure. There are insufficient decent jobs. 2/3 of all workers are employed informally, without a contract, often in hazardous conditions. Many are paid inadequately. The majority have no access to social protection and health care. Half our workforce survives on $5.50 a day, on the brink of poverty, at the mercy of pandemics, disasters, and economic downturns, or normal life events, such as falling ill or becoming pregnant. Healthcare is inadequate. 60% of workers finance their own healthcare and receive no sick pay. This is bad for workers' health and heaps physical, psychological, and financial burdens on them and their dependents. More people in this region are at risk of being pushed into poverty by health spending than anywhere else, causing inequalities to widen and lowering productivity and economic output. Social protection is lacking. Only a minority of workers in the formal sector contribute to a social protection scheme. Where benefits exist for others, they are often too low to cover basic needs. Excluding China, 2/3 of the population in Asia and the Pacific have no social protection whatsoever. The COVID-19 pandemic has pushed over 240 million people into poverty. These vulnerabilities have pushed workforce productivity below the global average. In response, we need access to decent jobs, universal health care, and social protection. Decent jobs require the formal sector to expand and to be governed by international labor standards. Active labor market policies must support lifelong learning, enabling workers to adapt to technological change, to new green jobs, and to longer careers. Training tailored to participants' needs and responding to local labor markets can be passports to decent employment, particularly when combined with cash grants and social protection. Universal health care should be extended gradually, making sure that lower-income groups are covered. A focus on primary health care as well as curative health protection is needed to improve health, worker productivity, and active aging. People who are chronically ill or live with a disability must be included into healthcare strategies. A package of universal child, old age, and disability social protection schemes set at the global average level would slash poverty in our region. And by guaranteeing income security and access, it would improve the workforce's resilience. Greater coverage of old age pensions would allow older persons to live independently and in dignity. Extending social protection to all means increasing public spending between 2 and 6% of the GDP. For most countries, this is a significant but affordable increase, but that requires the reprioritization of existing expenditure, taxation system reform, and the extension of contributory social insurance. Decent employment for all and an expansion of social protection and healthcare should be the foundation for a new social contract between the state and its citizens. One where mutual roles and responsibilities are clear, and where workers are given the security to fulfill their potential across Asia and the Pacific.